Red FM's FIFO Life, Big Al here with you, joined by Dr. John. How are you, mate?
Great, thanks, Miguel. How are you?
I'm doing fantastically. Today we're going to talk about something which I feel like we've almost been leading into this the whole time we've always had these chats, and that is when you finally get to that point where you go, I need to see some professional help, but what to expect from that first time that you do see that help. It can be pretty daunting.
Yeah, it can. I think, going to see a psychologist, in other words, essentially sitting down with a stranger and sharing your life and everything that's troubling you, is not a natural process.
Yeah,
okay?
100%.
Yeah, so it can be really anxiety-provoking for people, and we know that. So hopefully today I can share some of the things that happen. It's all really straightforward. There's nothing to be scared about at all, and just make the process a little bit easier for everyone.
Okay.
I think step one to do a technical sort of issue is the best thing to do is go and see your GP and talk with them about whether what's called a care plan is going to be appropriate. If you get a care plan, that means that the first 10 appointments in each calendar year can attract a Medicare rebate, and that can make a big difference for people who where money's a bit tight. If you see a clinical psychologist, the rebate's pretty substantial. It's $124.50 a session, so it can help, and it's certainly worth getting. The first time you see a psychologist, though, it's really just a getting to know you time. When someone walks in the door, I might have a little bit of information from their doctor, but it's really nowhere near the sort of information I need because as a psychologist, I need to understand you.
Yep.
And that really means you, what you've been going through, you in the context of your life, your friends, your family, and perhaps, if it's appropriate, even going back into your childhood. Sounds a bit Hollywood, but sometimes it's really, really important to understand your life trajectory and how you got here. Lots of people say, look, I've always been anxious. And, of course, if you've always been anxious, we need to understand perhaps where that began. One of the really important things about the whole process, though, is that we need to get on. You need to like me in a sense.
Okay.
It doesn't really matter if I'm technically the best psychologist on the face of the earth. If you don't like me, we're not going to work well together.
Yeah, I never thought about that. That's true.
Yeah.
Because I wouldn't want to talk to someone that I don't want to talk to, basically.
Yeah, exactly. Yeah. So there needs to be, just some sort of little bit of chemistry between us. You need to feel comfortable, and you need to kind of trust what I'm telling you as well.
Yep.
Because when it comes down to it, I'm not curing you. Okay? A psychologist can't intervene and really make a difference here. It sounds very cliched, and I guess it is, but all I can help you do is help you help yourself.
Okay.
And that's the most important part of the process. It's also something that I would love people to keep in mind when you do go and see a psychologist is that we work for you. You're the boss in this process. You drive it.
Okay.
And, of course, the more clear you can have in your mind about what you want to achieve, how coming to see a psychologist is going to make a difference in your life, the far more directed we can make the approach. I mean, every psychologist is going to have their own ideas about what might be happening, and, I'll share that with people, and it can get them thinking and they'll agree, but really it has to be directed by them. I can't presume to tell you what a good life is going to be for you, so have a bit of a think about it, and in as much detail as possible. Another important thing to keep in mind that does worry some people is about confidentiality.
Yeah.
And that's something that psychologists are really red hot on. We don't talk to anyone at all, about what is said to us in the room, okay? We do, with a care plan, have to write to the GP. That's just part of the Medicare requirements.
Yep.
But even when we do that, it usually doesn't contain the details of what we discuss. It's just really along the lines of what we've been doing and, where things are going and that sort of stuff. There are a couple of restrictions, of course. If we think there's a risk of you hurting yourself or someone else, we're going to do pretty well whatever it takes to stop that.
Yep.
But really, there aren't too many occasions beyond that where we're going to talk to people without your permission.
Okay.
After we've spoken to you, we'll come up with our ideas. We do an assessment, maybe even a diagnosis, and then we'll come up with a treatment plan that we will share with you. So we all need to know where we're going with this, and that should fit in with your goals. And then with each appointment, we develop that. We'll check in with how things have been. Obviously, the psych will make suggestions for what you do in between appointments because that's the most important thing. We're talking about people living their life differently and in a better way. So that's what they need to do. And that's really all it is. We're talking to people, we're guiding the process. Obviously, we have a lot of interventions that we can use for people with anxiety, depression, even trauma and things like that. But it's a really easy process. It's just getting to know people. There's really nothing to be scared of at all.
Excellent. People want to find out more information. Where can they go?
To www.fifofocus.com.au.
Excellent. Thanks so much for your time today.
Thanks, Miguel.
This is Red FM's FIFO Life, all thanks to Patterson and Dowding, one of WA's longest established family law practices, providing assistance in a range of areas, including achieving fair property settlements and living arrangements with your children for FIFO parents. For more details, go to their website, pattersondowding.com.au. Don't go anywhere. More FIFO Life to come after this.